Who here has heard of psychedelic drugs? Who has heard of psychedelic drugs being used to treat mental health issues? Psychedelic assisted therapy is an emerging field at the intersection of mental health treatment and altered states of consciousness. I have personally undergone such treatment, and it has changed the trajectory of my life entirely for the better. This approach involves the controlled use of substances like psilocybin, which are found in magic mushrooms, MDMA, and ayahuasca, just to name a few, to help individuals work through PTSD, depression, anxiety, addiction, and other mental health conditions. Research into the therapeutic benefits of psychedelics has exploded over the last decade. This period has become to be known as the psychedelic renaissance. Studies have shown that psychedelics, when used in structured and controlled setting, can help individuals confront deep-rooted emotional issues. These substances work by temporarily altering the brain's default mode network, otherwise known as DMN, which can lead to a more fluid thinking, emotional release, and a heightened sense of self-awareness. A landmark 2016 study led by Roland Griffiths at Johns Hopkins University found that, and I quote, participants who received a single dose of psilocybin in a supportive therapeutic setting reported significant reductions in anxiety and depression, with effects lasting up to 6 months. Over 80% of participants rated the experience as one of the most meaningful of their lives, end quote. This highlights the deep, introspective nature of the therapeutic healing process. Research from Imperial College, London in 2014, led by Dr. Robert Carhart Harris, showed that psilocybin decreases activity in the DMN default mode network, which is often overactive in individuals suffering from various mental health conditions. This disruption of the DMN allows the brain to form new neural connections, fostering neuroplasticity and offering patients the opportunity to break free from negative thought loops. Despite the promising results, the use of psychedelics in therapy is not without controversy. One of the primary challenges is overcoming the stigma surrounding these substances, which are often associated with recreational drug use and the counterculture movement of the 1960s. Psychedelics are still classified as a Schedule I substance federally, meaning they are considered to have no medical use and a high potential for abuse. This is not the case. However, as research has shown, so too is the public's understanding of the therapeutic potential of these substances. In recent years, cities like Denver, Oakland, and Santa Cruz, and more recently Olympia and Tacoma, have moved to decriminalize psilocybin, and in 2020, Oregon became the first state to legalize psilocybin for therapeutic use under a supervised professional. Another challenge is the legal landscape. While research is expanding, the legal status of many psychedelics remain a barrier to widespread access. However, looking forward, the future of psychedelic-assisted therapy is promising. With increasing support from both the scientific community, patient advocacy groups, we may soon see these therapies become more mainstream, providing a vital tool for people suffering from mental health conditions that have been difficult to treat by unconventional means. Continued research is crucial to understanding the full range of benefits and risks, and how psychedelics can be best used or integrated into existing therapeutic modalities. Additionally, as our understanding of consciousness deepens and our cultural perspectives shift, the integration of psychedelics into mainstream medicine can become a revolutionary force in the mental health field, providing a pathway to healing that was previously unimaginable. In conclusion, psychedelic-assisted therapy represents an exciting frontier in mental health treatment. From treating PTSD and depression to alleviating anxiety in terminally ill patients, psychedelics have the potential to revolutionize revolutionize the way we approach mental health care. While challenges remain, the growing body of research, regulatory changes, and shifting cultural perspective suggests that psychedelic-assisted therapy will continue to gain acceptance as a valuable treatment option. By embracing this innovative approach, we may unlock new pathways for healing for individuals facing some of the most challenging psychological conditions. Thank you.